早晨。
書展嗰方面啦，其實而家咁多本地個案啦，會唔會即係如果仲舉行嘅話，係將經濟凌駕於市民嘅健康啦？其實單純公共衛生嘅角度，其實你建唔建議舉行書展咁大型嘅聚集咧？
係，其實咧我諗任何大型嘅聚集咧都係唔會冇風險嘅嚇。咁就據我理解咧，其實我諗即係參展嘅單位咧，其實佢哋都有好多嘅嘅措施咧，係去例如確保咧人流啊，同埋咧係嗰啲感染控制啊，同埋咧係佢哋啲從業員啊等等咧，其實咧都係要保持嗰個衞生，同埋咧係嗰個人流嘅控制咧，一路咧係有處理嘅。咁當然咧，我哋對於而家整體嘅疫情咧都係擔心嘅嚇，咁所以咧我哋一路咧都會評估翻個風險咧，就去睇翻我哋嘅措施有邊啲咧係需要有調節。咁呢個咧我哋一路咧係每一日咧都會做緊嘅嚇。
但係書展咁多人流咧，其實如果真係有確診個案，可以點樣追蹤到？究竟咩人會被列為密切接觸者咧？
我諗而家如果呢啲嘅大型嘅活動咧，當然咧，正如我所講，都係冇風險，都係有風險啊。咁而我諗嗰個即係保持一個嘅距離啊，同埋咧係喺個人流嗰個控制嗰度咧，係如果真係要搞嘅話咧，呢啲咧都係要留意咯嚇。
From your standpoint, is it even worth the risk now that you're saying major events, major gatherings all contain risk? Is it even worth the risk? Would you advise other government departments and the Trade Development Council to postpone the event to contain the risk now that we're at this situation? And sorry, my second question is about your assessment comparing the situation of local infections now compared to the second wave in March. Even though we have a much lower number, local infections, we just saw a record daily number a few days ago. So what's your assessment comparing these two periods? Why are we not having as tight social distancing measures as the previous second wave?
Okay, thank you for your question. First of all, I think in terms of gathering, any gathering, there are certain risks. And as a result, I think if there are gatherings that need to be held, they must have the infection control measures, and also the people flow must be very carefully orchestrated in order to lower the risk as far as possible. Of course, now the epidemic is worrying, and so therefore we are actually assessing the risk on a daily basis. We are also trying to trace all the confirmed cases as well as all the contacts, whether it is close contacts or contacts of the confirmed cases or contacts of contacts. So the Center for Health Protection colleagues are working tirelessly in terms of doing all this. We are also doing a lot of testing because all the confirmed cases, the places where they live, where they work, and also places where their whereabouts, where they go to, for example, markets and also shopping malls. So we are also trying to do more testing in terms of these confirmed cases' whereabouts. We are also working on testing for target groups. For example, the staff of the elderly homes, the taxi drivers, and also the workers of the catering business. So we are working on this. Regarding your second question about the social distancing measures, now obviously before this outbreak, I've always emphasized that we have entered into a new normal. And so therefore, the society would have to understand that the virus is always with us. And also looking at the experience of other countries, for example, Japan, Korea, actually when they go back to the normal life, the epidemic situation and the number of cases have increased. So this is kind of expected. But of course, in this situation, whereby we have in a short time a large number of cases, and also spread over different places, such as elderly homes and also small eateries, as well as there are also taxi drivers and so on, and also in some of the public housing estates. This is very worrying. But then I think we have experience in handling, all these, be it contact tracing, testing, quarantining, and also isolation. So these are our major strategies right now. The second strategy is obviously we have tightened the social distancing measures. Now those are social distancing measures that are by law. If you know that is the CAP 599F by law. But then it doesn't mean that there are other social distancing measures that, for example, the public, cannot employ themselves, other than, for example, wearing masks, especially wear masks when they are not eating, even in a restaurant. There are also other measures. For example, I would appeal to the public to try to stay at home and not go to the gatherings as far as possible, at least at this initial period. And after we have continuously assessed the situation, we do not preclude that there will be other measures.係我其實咧了解咧就係勞工處咧佢哋係有一個名單嘅對於呢啲酒店咧係有一個名單，咁咧就佢會將呢個名單咧就俾呢啲嘅僱主啦咁然之後僱主咧亦都係可以咧係喺呢啲名單嘅酒店嗰度選擇，同埋咧係同佢哋去聯絡嘅。而家暫時我哋就唔聽到咧勞工處講咧佢哋係喺呢方面咧係有困難。當然咧佢哋都會密切留意嗰個名單咧，我相信咧如果係有問題嘅話咧，佢哋都會係再處理嘅嚇。
咁而家係有計劃咧，即係全機組人員要量到陰性先領走。如果係嘅話咧，係預計幾時落實啦？同埋喺同航空公司溝通上有冇困難咧？第二條就係想問下，即係其實本地化或者幾日查查徵商會停課，會唔會覺得有啲遲？係嗱，其實咧，我哋因應呢個嘅新嘅常態咧，呢一個嘅爆發咧，我哋咧都係盡我哋最大努力咧，去第一就評估嗰個整體嘅情況啦。第二咧就係話我剛才所講咧，就係話做一個追蹤啊、檢測啊，同埋係隔離啊、檢疫啊，呢啲咧係即係最急嘅一啲嘅工作。咁而我哋咧對於例如喺口岸嘅管制啊、社交距離嘅一啲法例上嘅一啲嘅指示啊，同埋做琴日咧係復課啊咁樣啦，都係我哋喺風險評估後咧，其實咧一路咧係推出嘅一啲嘅措施嘅。咁當然我哋亦都係唔排除咧係一路我哋風險評估監察嗰個整體嘅情況咧，係再有其他嘅措施。咁呢個亦都係顯現到咧係我哋張弛有度對於而家嗰個情況咧，因為個病毒咧其實都係唔會走嘅都係喺度嘅。咁所以咧，我哋都會係大家希望咧，都係要理解咧，都會係有呢啲咁嘅情況啦，整體係而家咧就係有一啲以前咧都係豁免嘅一啲機組嘅人士啊，或者係船員啊嗰啲咧，其實就因為佢哋都係可能嚟咗或者係好快就走咁樣，咁所以咧以前咧就係豁免咧就係冇特別咧係去做一個檢測嘅，因為佢哋都唔應該咧係即係出到去個社區嗰度嘅。咁但係咧而家咧亦都因為我哋發現咧都有一啲嘅確診嘅個案啦，同埋咧衛生署咧就已經喺我諗前2日咧已經係開始咗係做一個嘅檢測㗎啦嚇咁但係咧我哋更加穩妥咧，我哋就希望除咗喺香港咧係同佢哋做一個病毒嘅檢測之外咧，我哋都要要求咧佢哋咧係喺嚟之前咧，佢哋已經係做咗檢測，然之後咧係陰性咁樣咯嚇。好多謝晒嚇。